Welcome to Lesson 11 of the KS Medical Coding Academy 2026 CPC course, NCCI, Bundling, and MUEs. In this lesson, we'll learn how to recognize procedure-to-procedure edits, bundling concepts, and medically unlikely edits. For your CPC exam, remember 3 simple rules. PTP, check the code pair. Bundling, check whether the service is included. MUE, check the units. Let's begin and understand how these concepts affect correct surgical coding. Before we begin the detailed concepts of NCCI, bundling, and MUEs, let's look at what you should be able to understand by the end of this lesson. First, we'll explain the purpose of the National Correct Coding Initiative, or NCCI, and understand how procedure-to-procedure, or PTP, edits work. We'll also examine bundling concepts, including services that are considered part of another procedure. Next, we'll learn about medically unlikely edits, or MUEs, and why checking the appropriate number of units is important. We'll also discuss NCCI modifier indicators and apply these concepts to CPC-style scenarios. For 2026 accuracy, remember that NCCI and MUE information can change. Always verify the current CMS files based on the date of service, service setting, code combination, and applicable reporting requirements. And keep this CPC memory rule in mind. PTP means check the code pair, bundling means check what is included, and MUE means check the units. This lesson is for educational and CPC exam preparation purposes. Always verify current CPT, CMS, NCCI, payer, and other applicable official guidance before making actual coding decisions. Now let's understand NCCI, which stands for National Correct Coding Initiative. NCCI is a CMS program designed to promote correct coding methodologies and help reduce improper payments for applicable Medicare Part B claims. For this lesson, focus on 3 important NCCI components: PTP edits, MUEs, and add-on code edits. PTP edits address code pairs that generally should not be reported together, MUEs address inappropriate units of service, and add-on code edits address the relationship between add-on codes and their primary procedures. For the CPC exam, remember, NCCI means check the correct coding rules before reporting services together. One important point: NCCI is a coding edit program, not a medical necessity or prior authorization program. And because NCCI files are updated, always verify the current CMS files that apply to the service setting and date of service. Now let's focus on PTP edits, which means procedure-to-procedure edits. NCCI PTP edits identify captain and HCPCS code pairs that generally should not be reported together for the same beneficiary, same provider, and same date of service. CMS organizes these edits into Column 1 and Column 2. Generally, the Column 1 code is eligible for payment, while the Column 2 code may be denied when both are reported together. The key point for the CPC exam is the correct coding modifier indicator, or CCMI. An indicator of 0 means the edit cannot be bypassed with an NCCI-associated modifier, while 1 means an appropriate NCCI-associated modifier may allow the edit to be bypassed when the clinical circumstances and documentation support it. Indicator 9 indicates that the use of an NCCI-associated modifier is not specified. Remember, never add a modifier simply to bypass an edit. The documentation and clinical circumstances must justify the modifier. Your CPC memory rule is simple. PTP, check the code pair, check the modifier indicator, and verify the documentation. Finally, CMS updates PTP edit files quarterly, so always use the current file that applies to the service setting and date of service. For 2026, the current Quarter 3 files are effective July 1, 2026. Each NCCI procedure-to-procedure edit includes a correct coding modifier indicator, or CCMI, which tells us whether an NCCI-associated modifier may be used to bypass the edit. There are 3 important indicators to remember. Indicator 0 means the edit cannot be bypassed with an NCCI-associated modifier. Indicator 1 means an appropriate modifier may bypass the edit when the clinical circumstances and documentation support separate reporting. Indicator 9 means the modifier indicator is not applicable to the edit. For the CPC exam, remember, 0 means stop, 1 means may be allowed, verify, and 9 means not applicable. Also, never add a modifier simply because you see an NCCI edit. The medical record must support the separate service and the modifier being reported. Some commonly recognized NCCI-associated modifiers include 59 and the X, EPSU, modifiers, as well as certain anatomic and global surgery modifiers. However, always verify the current CMS NCCI policy manual and applicable edit files rather than relying on memorization alone. The key CPC rule is: check the code pair, check the modifier indicator, verify the documentation, and then report only what is supported. Now let's understand bundling concepts, which are very important for both surgical coding and the CPC exam. Bundling occurs when a service is considered an integral or component part of another, more comprehensive service and therefore is not separately reportable when performed as part of that service. CMS explains that NCCI PTP edits often reflect services that are integral to a more comprehensive procedure. Think of it this way: one comprehensive procedure may already include certain component services. Reporting those components separately can result in incorrect coding or inappropriate payment. Examples of services that may commonly be considered integral include surgical approach, wound irrigation, surgical closure, certain anesthesia services, dressings, and other routine components, depending on the procedure and applicable coding rules. For the CPC exam, don't assume that every service performed during a procedure should automatically receive its own code. First, check the CAPTAIN code description and guidelines, then review applicable NCCI edits and the documentation. Here's your CPC memory rule: bundle smart, code correctly, and report only services that are separately reportable. And remember, NCCI edits do not contain every possible correct coding situation. Even when an edit does not exist, the coder is still responsible for applying correct coding principles. The final rule is simple: check what is included before reporting a service separately. Now let's focus on MUEs, or medically unlikely edits. An MUE is a unit of service edit that represents the maximum number of units generally reported for a CPT or HCPCS code for the same provider or supplier, same beneficiary, and same date of service. MUEs help identify potential errors involving excessive or incorrect units. For the CPC exam, think of the workflow this way: identify the code, check the MUE value, review the units reported, understand how the MUE is adjudicated, and report only the units supported by the documentation and applicable rules. You'll also see MUE Adjudication Indicators, or MUEs. These indicators help determine how the MUE is applied, such as at the claim line or date of service level. Here's an important CPC trap. An MUE does not simply mean that reporting more units is never possible in every circumstance. You must understand the specific edit, its adjudication method, the code definition, documentation, and applicable Medicare coding rules. Remember the three-part memory rule. PTP means check the code pair, bundling means check what is included, and MUE means check the units. Finally, MUE files are updated periodically, so never rely on memorized values. Always verify the current CMS MUE file applicable to the service setting and date of service. Now let's look at MUE Adjudication Indicators, or MUEs. The MUE tells us how a Medicare MUE is applied during claim adjudication. CMS identifies three categories: MAI-1, MAI-2, and MAI-3. MAI-1 is a claim line MUE. The units reported on each claim line are evaluated against the MUE value. When appropriate, medically necessary units may sometimes be reported on separate claim lines using applicable modifiers, subject to CMS rules. MAI-2 is an absolute date of service MUE. It is based on factors such as anatomical considerations, the code definition, or published CMS policy, and units beyond the applicable MUE are not separately payable under the Medicare MUE policy. MAI-3 is also evaluated at the date of service level. When medically necessary units exceed the MUE, appeal considerations may exist when the documentation and applicable CMS requirements support the services. For the CPC exam, remember, MAI-1 means check the line, MAI-2 means absolute date of service rule, and MAI-3 means check the date of service and adjudication rules. And here is an important trap: MUE is not a modifier. Do not confuse MUE with the CCMI, which is the NCCI PTP modifier indicator. Finally, NCCI files are updated periodically, so always verify the current MUE file and applicable service setting guidance. Your final workflow is: MUE right pointing arrow check the units, right pointing arrow check the MUE, right pointing arrow verify documentation, right pointing arrow apply current CMS rules. Now let's compare three important concepts: NCCI, bundling, and MUEs. First, NCCI, or National Correct Coding Initiative, is the broader CMS program that contains coding policies and edits designed to promote correct coding and reduce improper payments. Bundling is the concept that one service may be considered included in another, more comprehensive service and therefore may not be separately reportable. MUE, or Medically Unlikely Edit, focuses specifically on units of service. It helps identify situations where the number of units reported for a CPT or HCPCS code may be inappropriate. For the CPC exam, keep these 3 memory rules simple. PTP means check the code pair. Bundling means check what is included. MUE means check the units. Here's an important trap. NCCI, bundling, and MUE are not interchangeable terms. Also, the absence of an NCCI edit does not automatically mean that a code combination is correct. You still have to apply CAPTAIN guidelines, documentation requirements, and other applicable coding policies. Your coding workflow should be: documentation right pointing arrow CAPTAIN guidelines right pointing arrow NCCI policies and edits right pointing arrow check the code pair right pointing arrow check what is included right pointing arrow check the units right pointing arrow report only what is supported. Finally, always verify the current CMS files and policy guidance applicable to the service setting and date of service. Remember, understand the edit, understand the bundle, check the units, and always code from the documentation. Now we come to an important 2026 special point. Always verify the current NCCI files. NCCI information can change, so coders should never depend on an old edit list or memory. CMS updates Medicare PTP and MUE files at least quarterly, making it important to use the file that applies to the specific coding situation. For PTP edits, verify the code pair, column 1 and column 2, modifier indicator, and effective or deletion dates. For MUEs, check the current MUE value, the MUE Adjudication Indicator, and the appropriate provider or service setting file. For add-on code edits, verify the relationship with the required primary procedure and the current edit status. Service setting is also important. Make sure you are using the appropriate CMS file for the applicable service type and date of service. For your CPC exam, remember this verification sequence: date right pointing arrow setting right pointing arrow code right pointing arrow edit right pointing arrow documentation. The common trap is relying on a previous quarter's file or assuming that an edit applies to every setting. So the final rule for this lesson is: never code from memory when an NCCI edit can change. Verify the current CMS file. Now let's apply what we've learned to a CPC-style scenario. Imagine a surgeon performs 2 procedures on the same patient during the same operative session. The coder enters both CAPTAIN codes and discovers that CMS lists the code pair as an active NCCI PTP edit with CCMI 1. The documentation shows that the second procedure was performed at a separate anatomic site and is distinct from the primary procedure. So what should the coder do? The correct approach is to review the documentation, verify the PTP edit and CCMI, and determine whether an appropriate NCCI associated modifier is supported. The important point is that CCMI 1 does not automatically mean add modifier 59. It means an NCCI associated modifier may be appropriate when the clinical circumstances and documentation support separate reporting. The coder should follow this workflow: documentation right pointing arrow verify PTP edit right pointing arrow check CCMI right pointing arrow confirm distinct circumstances right pointing arrow select the appropriate modifier, if supported right pointing arrow report the codes. Here's the common CPC trap: adding a modifier simply to overcome an NCCI edit. Remember, CCMI 1 means may be allowed, verify, document, then report. And the final rule is: an NCCI edit is a reason to investigate, not a reason to automatically add a modifier. Let's review the key concepts from Lesson 11, NCCI, Bundling, and MUEs. First, NCCI is the CMS correct coding program that includes important edit systems such as PTP edits, MUEs, and add-on code edits. For PTP edits, remember, check the code pair, review the modifier indicator, and verify the documentation before considering an NCCI associated modifier. For bundling, ask, is this service already included in another procedure? Report it separately only when the coding guidelines and documentation support separate reporting. For MUEs, remember, check the units and review the applicable MUE Adjudication Indicator, or MUE. For the CPC exam, avoid common traps such as automatically adding a modifier, treating CCMI 1 as an instruction to add modifier 59, confusing MUE with CCMI, or relying on outdated NCCI and MUE information. Your complete coding workflow is documentation, right pointing arrow, captain guidelines, right pointing arrow, code specific instructions, right pointing arrow, NCCI, PTP edits, right pointing arrow, bundling, right pointing arrow, MUE, MUE, right pointing arrow, payer and service setting requirements, right pointing arrow, correct reporting. And remember the 3 most important CPC memory rules: PTP, right pointing arrow, check the code pair; bundling, right pointing arrow, check what is included; MUE, right pointing arrow, check the units. For 2026 accuracy, always verify the current CMS files applicable to the service setting and date of service. Finally, remember this rule: don't bypass an edit, understand why it exists, verify the current rules, and code from the documentation.